Hi, I'm Dr. David Berman, and I'm doing a smart lipo on a 55-year-old woman who was kind enough to let me videotape her for the procedure. So what I've done is I've obviously seen her previously, discussed everything, gone over detailed consent forms. She's obviously back here today. She took a little Ativan, which is like a little Valium, so somebody drove her, but she's quite awake. Say hello.
Hello.
And what I've done is I've got a series of spots along her back that I've numbed up. In a minute the camera will get a little closer and you can see the incisions are very, very tiny. What we're focusing on today is really the lateral back area where she's accumulated a little more adipose tissue than she would like, and also the flank area, the love handles, and we're also going to deal with the inner thighs. We'll obviously do one side then the other, and then she's actually coming back tomorrow because she's so enjoying the procedure, and tomorrow we're going to work on her abdominal area and her inner thigh area. So far it's been completely painless. Am I telling the truth?
Yep. Can't feel anything.
Great. So what I did is I numbed up with a very, very tiny needle a few little incisions, and the incisions are only about 3 millimeters, which is extremely small. What I have here is a little cannula, and that's gone through one of the little tiny incisions into the area where the fat is, and if you follow the tubing it goes to an IV bag where I have the local anesthetic in quite a high concentration, and I'm infiltrating it. If there's a little pedal on the floor, and every time I step on it I'll infiltrate. And this is really the first part of the procedure where I completely numb her up, and it should be very, very comfortable, and after that she won't feel anything. A minute ago is we've numbed up these areas. This area is numb, this area is numb, this area is numb, this area is numb. There's very, very tiny incisions. This is the fiber optic laser fiber. This is of course the machine, the Cynosure triplex for smart lipo. And what I'm doing now, and you'll see it's completely painless, I insert it gently, there's nothing rough about it. Every time I step on the pedal, I move it back and forth, and the laser's firing multiple times a second and melting fat. And as you can see, she's quite comfortable. Say hello and tell them you're comfortable.
Hello. I'm very comfortable.
That's good. And there's been no pain at all throughout the procedure, and nor should there be really at all. And this part's completely numbed up, so it should be completely painless. And every time I move it back and forth, fat's being melted. What I'll be doing shortly is I'll take this out, I'll of course do all these areas, we'll do the other side, we'll do her inner thighs, and then I'll bring you back and show you liposuction and taking the fat out from these areas. But as you can see, it's painless, it's gentle, the incisions are almost invisible, and with a little bit of time they'll be extremely hard to see. We finished lasering her, and we've done all these sites here, inner thighs, and of course the same on the other side. This is a liposuction cannula. It's although it's long, it's actually quite thin. It's got 3 holes at the end, and it's connected to a liposuction device. And as you can see, what I'm doing is I'm going in gently, and again, there's nothing forced, there's nothing aggressive, there's nothing mean, and she's comfortable while I'm doing it. All she has to do is tell me if she's a little uncomfortable. We can always put more local in. And as you can see, it's very controlled and very smooth. And I'll do this for some time to each of those sites. And then when I'm done, I'll put a little tiny dissolving suture in each of these and a little stair strip, and then she'll put on a pair of Spanx or spandex, and she'll go home.